A person who's truly born again by nature desires...
Holtzinger is a pastor of a small congregation, so the healthcare ministries did appeal to his faith. They also appeal to his political beliefs. He blames healthcare reform for part of his insurance rate hike, and he's worried about what he perceives as a creeping government takeover of healthcare. So he followed the development of the individual mandate closely.
I was fully aware that that was there. Of course, I objected to the whole concept. I think any time a government agency asks you to buy something, forces you to buy something, there's a loss of liberty.
Pastor Holtzinger said it felt liberating to be able to opt out of the individual mandate by joining a healthcare sharing ministry. But he also likes the chance to live out his Christian values while saving $700 a month for him and his wife, money he worried was going to bankrupt his small church. And as for the fee he does have to pay, he says he does so with joy.
So I've gone from being angry to being excited about writing a check for $270. And on my income level, $270 is a lot of money. So, and I love it. I get to write a check to an individual, and I know 100% of that money is going to help that individual.
Christians who sign up for sharing ministries seem to actually be happy with their health care. You don't hear that about many traditional insurance companies. But people who regulate insurance companies are very concerned. They say the ministries are not insurance, and if consumers don't know what they're buying into, that could be dangerous for them and the healthcare system as a whole.
You will be sending it then soon?
The ministry's message is not always crystal clear. Take this promotional video.
You know, the feeling's priceless when I get a call that my husband's on the way to the hospital with a heart attack. I'm walking into the emergency room. I knew that the financial need was going to be cared for.
Critics say this sounds to be an insurance-like legal guarantee of payment, and that is misleading.
The concern with a sharing program as a panacea is that it's a complete fiction.
Michael McCraith is the Illinois State Insurance Director, and he was just this week elevated by President Obama to be the United States' top insurance official. He's the nation's leading voice of concern over health care sharing ministries.
These are not insurance programs. First of all, they are operated on a cash flow basis. There's no certainty that if one participant makes a payment this month, that 6 months from now, that enterprise, that ministry is going to be around. They might not have sufficient capital in 6 months to pay any claims. Somebody sees a physician, claim will be paid. Car accident, no certainty. Cancer, no certainty.